My name is Abigail Carrick. This is my second year in 4-H, and this is my second presentation. Today I'm going to be talking about fluted and UTIs in cats. Fluted stands for feline lower urinary tract disorder, and UTI stand for urinary tract infections. Okay, so the first thing I'm going to start talking about is UTIs. UTIs are infections that your cat can get in the urinary tract, boys and girls, and it's also something that humans can have as well. UTIs, some of the symptoms, if you notice these, your cat might have a UTI, is frequent use of the litter box, blood in their urine, and yowling and crying. So basically, they'll usually let out uncomfortable noises while they're using the litter box. They also strain a lot, so you'll see them visibly strain when they're in the litter box. So how UTIs happen is their urethras tend to get clogged. So UTIs and fluted are a lot more common in males because they have this little dip in their urethra. So a lot of crystals and slush can just get kind of stuck right here, so they have a lot more trouble with urinary problems, but both females and males get it. So if you don't treat a UTI when you notice it, it can turn into fluted, which is a lot more serious than just a little UTI. When you notice that your cat has a UTI, you bring them to the vet and they will diagnose your cat with a UTI, and they'll give you a urinary diet. So you feed them whether it's kibble or canned specialty food, so like canned food that is good for them. And you'll put them on the diet for a while, and then you can take them off after it's starting to get better, and they'll give you some medicine, so usually some like muscle relaxants and that sort of thing. And so exactly, once you notice a UTI, you need to take your animal to the vet as soon as possible just to get it taken care of. It can cause them a lot of pain and uncomfortability, which you don't want. Fluted stands for feline lower urinary tract disease. It is a lot more serious than just a regular UTI that your cat would get. They form crystals in their urethras, which is a lot more of a problem. What you really don't want is your vet to tell you that your cat has an obstructed bladder. It can be very, very serious, so you really don't want that to be the case. Some symptoms that your cat may have fluted is depression, loss of appetite, inability to move, peeing outside of the litter box. So they might, pee near the litter box, and sometimes that can just be a marking behavior, but they also pee themselves sometimes, so they'll lay down and they won't want to get up, and you'll just notice urine forming in a pile. If your cat has a history of UTIs, so in their life they've gotten several UTIs and you've treated them but they've just come back, they're more at risk for fluted. And so when your cat has fluted, your doctor or your veterinarian will tell you. And so the most common treatment is medicines and urinary food, which you'll have to keep them on their whole entire life after that point. But you give them a catheter surgery. So a catheter is a long tube that they put in their urethra, and they kind of use it as like a vacuum to get out all the crystals. And they usually keep the cat overnight, and then you give them medicine for a few weeks, and you keep them on their urinary food for basically the rest of their life. And so that's their treatment. Feline lower urinary tract disease has a lot of risks. If left untreated, it can lead to kidney failure. So their urine just kind of blocks up their bladder, which can go into their ureters and into their kidneys, which is a very serious thing. They can have toxic urine with all the crystals in them, so it's bad for people as well to take care of that because it can make you very sick, and it's also really bad for the cat. And then unfortunately death also can come with this because a lot of things go wrong when they have fluted. And so another thing is without catheters, their basically the only other option is to put them down, but some cats are born with fluted, so you can't really control if they have it or not. Sometimes they're just born with it. So like another thing is you want to try and get a cat that has, like, they know the mother. So like shelter cats can be a problem because they don't really know sometimes what the mom went through when they're pregnant. And you want to make sure, because the mom needs to be healthy and the father needs to be healthy, and the mom needs to be watched through her whole entire pregnancy, because sometimes if they swallow like outdoor chemicals or whatnot, they can get sick, and then that makes the children sick, and they have a lot higher of a risk to have fluted. Fluted can be noticed at any time in their life, but usually if they're going to have it, it'll be noticed when they're around 2 years old. And then there is another treatment that you can get called a perennial urethrostomy. So that is basically a change of sex surgery for the males. The females don't get this because they don't really get fluted that much, but they can have it. But the males are at a lot higher of a risk. And so they change basically their sex and make them more of a female, so that they have an easier way of urinating and just in general being healthy, and it keeps them, good. So a few ways that you might be able to try and prevent this with your cats, just in general. Water fountains is a great way. You can do like drinking water fountains where it like circulates the water, and the cats really like that. Encouraging hydration, so just like trying to get them to drink more, monitoring their urination, how much they urinate. Pretty Litter is a brand of litter that changes colors with what's in your cat's pee, so it'll tell you if it's acidic or anything's wrong with it. And just keeping them on a urinary diet. Sometimes when the males are older, you can put them on a urinary diet, and it will kind of try and prevent what they might get. So thank you. Does anyone have any questions?
I have a question. How does the surgery that you were talking about change the cat's anatomy?
They take out part of the urethra and they shorten it. So they'll go in there and they'll kind of make this straighter on the males so that it's not like that dip. So it's easier for them to pee.
And you referred to it as being similar to a sex change
Yeah.
surgery. How is this?
They take away the penis. They take it off completely, and if your cat isn't already neutered, they'll neuter it at the same time.
Okay. You mentioned food. You mentioned kibble. Do you normally feed a cat with UTI kibble, or is it mostly more of a wet food?
It's usually more common to get kibble. You can get canned urinary food, but they also have canned kibble. So you can feed them either and it works the same.
Okay. And you mentioned some type of medication, but you didn't seem to know what. Did you know the names of the medication?
There is a couple. There is muscle relaxants. A very common one is gabapentin. So they'll give you prescriptions like that and feed it to your cat and just keep them on it for a couple weeks. Usually it's in pill form, but sometimes they'll give you it in liquid form. Yes.
So I just have a question. How did you choose this topic? Do you ever have a cat that had?
I had a cat pass away right before fair last year. He struggled with UTIs from December to May, and we treated him for UTIs several times, and then the vet told us that he had fluted, so we took him to the vet and we gave him the catheter surgery, and unfortunately that didn't work. It's really just about how lucky you get. I mean, you can try your hardest, but it doesn't always work. So he passed away. We had to get him put down, and that was really unfortunate. Luckily, I had another cat who was in good condition to go to the fair, so I brought her instead.
Sorry to hear about your cat.
Yeah.
I have a cat that had this too.
It's unfortunate, yeah.
How much does it cost to treat a urinary tract blockage with a catheter?
Catheter surgery is usually around $3,000. Perennial urethrostomies are around $10,000, so it can be a lot of money, which is why it's really hard for people when their cat gets it. A lot of people choose to put them down, and honestly, if it's going to be a hardship for a family and it's not guaranteed to work, you want to do what's best. So.
Thank you.